Introduction: Obsessions, Compulsions, and the Four-Step Self-Treatment Method. We all have our little quirks, habits, and behaviors that we know we'd be better off without. We all wish that we had more self-control, but when thoughts spin out of control, becoming so intense and intrusive that they take over against our will, when habits turn into all-consuming rituals that are performed to rid us of overwhelming feelings of fear and dread, something more serious is happening. This is obsessive compulsive disorder, OCD. The victims of OCD engage in bizarre and self-destructive behaviors to avert some imagined catastrophe, but there's no realistic connection between the behaviors and the catastrophes they so fear. For example, they may shower 40 times a day to ensure that there will not be a death in the family, or they may go to great lengths to avoid certain numbers so as to prevent a fatal airplane crash. Unlike compulsive shoppers or compulsive gamblers, people with OCD derive no pleasure from performing their rituals. They find them extremely painful. That's very much true. Almost certainly, OCD is related to a biochemical imbalance in the brain that we now know can be treated very effectively without drugs. We know too that the four-step self-treatment method you will learn in this book enables people with OCD to change their own brain chemistry. Furthermore, this method can be applied effectively to take control over a wide variety of less serious but troublesome and annoying compulsive habits and behaviors. If you may think you may have OCD, the University of Hamburg Obsession Compulsion Inventory Screening Form on page 198 may help you find out. If you don't, the techniques you learn in this book may help you overcome other troubling and annoying habits and behaviors. Simply defined, OCD is a lifelong disorder identified by two general groups of symptoms: obsessions and compulsions. Once thought of a curious and rare disease, it in fact affects 1 person in 40 in the general population, or more than 5 million Americans. A disorder that typically has its onset in adolescence or early adulthood. OCD is more common than asthma or diabetes. It is a devastating disease that often creates chaos in the lives of its victims and those who love them. The preoccupation with repetitive behaviors such as washing, cleaning, counting, or checking causes trouble on the job, leads to marital strife, and difficulty with social interaction. Family members may become impatient and angry, demanding, "Why don't you just stop?" Or they may aid and abet the performance of the silly rituals to buy an hour's peace, which is a very bad idea. So what are obsessions? Obsessions are intrusive, unwelcome, distressing thoughts and mental images. The word obsession comes from the Latin word meaning to besiege, and an obsessive thought is just that, a thought that besieges you and annoys the hell out of you. You pray for it to go away, but it won't, at least not for long or in any controllable way. These thoughts always create distress and anxiety. Unlike other unpleasant thoughts, they do not fade away, but keep intruding into your mind over and over again against your will. These thoughts are, in fact, repugnant to you. Say that you've seen a beautiful woman and can't get her out of your mind. That is not an obsession. That is a rumination, something not inappropriate and quite normal and even pleasant. If Calvin Klein's marketing department had really understood the word obsession properly, the perfume would have been called rumination. Getting the wrong message. Because these obsessions don't go away, they are extremely difficult to ignore. Difficult, but not impossible. We now know that OCD is related to a biochemical problem in the brain. We call this problem brain lock because of 4 key structures of the brain become locked together, and the brain starts sending false messages that the person cannot readily recognize as false. one of the main signal processing centers of the brain, made up of two structures called the caudate nucleus and the putamen, can be thought of as similar to a gear shift in a car. The caudate nucleus works like an automatic transmission for the front, or thinking part of the brain, working with the putamen, which is the automatic transmission for the part of the brain that controls body movements. The caudate nucleus allows for the extremely efficient coordination of thoughts and movements during everyday activities. In a person with OCD, however, the caudate nucleus is not shifting the gears properly, and the messages from the front part of the brain get stuck there. In other words, the brain's automatic transmission has a glitch. The brain gets stuck in gear and can't shift to the next thought. When the brain gets stuck, it may tell you, you must wash your hands again, and you'll wash, even though there's no real reason to do so. Or the brain might say, you'd better check that lock again. And you'll check again and again, unable to shake off the gnawing feeling that the door may be unlocked. Or an intense urge to count things or to reread words may arise for no apparent reason. By applying behavioral therapy techniques, you can change how you respond to these thoughts and urges, and you can physically change the way your brain works. The use of these techniques actually make the automatic transmission in the brain shift more smoothly, so that over time the intrusive urges decrease. One patient at UCLA, Dottie, on being told that her problem was caused by a biochemical imbalance in her brain, immediately brightened and coined the catchphrase, "It's not me, it's my OCD." To most people with OCD, this realization alone comes as a great relief. Washing, checking, and other OCD rituals consume hours of time each day and make the lives of people with OCD miserable. People with OCD may even fear that they're going crazy. They know that their behavior is not normal. Indeed, the behavior is apt to be foreign to their personalities or self-image. Yet, until they learn the 4-step self-treatment method, they're unable to stop themselves from responding to the brain's false alarms. What are compulsions? Compulsions are the behaviors that people with OCD perform in a vain attempt to exorcise the fears and anxieties caused by their obsessions. Although a person with OCD usually recognizes that the urge to wash, check, or touch things or to repeat numbers is ridiculous and senseless, the feeling is so strong that the untrained mind becomes overwhelmed and the person with OCD gives in and performs the compulsive behavior. Unfortunately, performing the absurd behavior tends to set off a vicious cycle. It may bring momentary relief, but as more compulsive behaviors are performed, the obsessive thoughts and feelings become stronger, more demanding, and more tenacious. The afflicted person ends up with both an obsession and an often embarrassing compulsive ritual to go with it. It is not surprising that many people with OCD come to see themselves as doomed and may even have suicidal thoughts by the time they seek professional help. In addition, years of traditional psychotherapy may have served only to confuse them further. So now we're going to look into the checklist of common OCD symptoms that they listed here. So they have obsessions about dirt and contamination, unfounded fears of contracting a dreadful illness, excessive concerns about dirt, germs, including the fear of spreading germs to others, and environmental contaminants such as household cleaners, feelings of revulsions about bodily waste and secretions, obsessions about one's body, abnormal concerns about sticky substances or residues. Then it goes into the obsessive need for order or symmetry, an overwhelming need to align objects just so, abnormal concerns about the neatness of one's personal appearance or one's environment, obsessions about hoarding or saving, stashing away useless trash such as old newspapers or items rescued from trash cans, the inability to discard anything because it may be needed sometime, a fear of losing something or discarding something by mistake, Obsessions with sexual content, sexual thoughts that one views as inappropriate and unacceptable, repetitive rituals, repeating routine activities for no logical reason, repeating questions over and over, rereading or rewriting words or phrases, nonsensical doubts, unfounded fears that one has failed to do some routine tasks such as paying the mortgage or signing a check, religious obsessions, troublesome blasphemous or sacrilegious thoughts, excessive concerns about mortality and right or wrong, obsessions with aggressive content, the fear of having caused some terrible tragedy, such as a fatal fire, repeated intruding images of violence, the fear of acting out a violent thought, such as stabbing or shooting someone, the irrational fear of having hurt someone, for example, the fear of having hit someone while driving. And then it goes into more OCD behaviors, such as superstitious fears, the belief that certain numbers or colors are lucky or unlucky, compulsions of cleaning and washing compulsions, excessive ritualized hand washing, showering, bathing, or toothbrushing, the unshakable feeling that household items such as dishes are contaminated or cannot be washed enough to be really clean. Compulsions about having things just right, the need for symmetry and total order in one's environment, for example, the need to line up canned goods in the pantry in alphabetical order, to hang clothes in exactly the same spot in the closet every day, or to wear certain clothes only on certain days. The need to keep doing something until one gets it just right. The feeling of just right is something that people with OCD do relate and know that feeling that you can't stop doing it or checking it until it feels just right. And if you know what that means, then you really know what that means. What it means to have something be just right or get it to be just right. Hoarding or collecting compulsions, minutely inspecting household trash. In some case, some valuable item has been thrown out, accumulating useless objects, checking compulsions, repeatedly checking to see if a door is locked or an appliance is turned off, checking to make certain one has not harmed someone, for example, driving around and around the block to see if anyone has been run over, checking and rechecking for mistakes such as when balancing a checkbook, checking associated with bodily obsessions such as repeatedly checking oneself for signs of a catastrophic disease. Other compulsions, pathological slowness in carrying out even the most routine activities, blinking or staring rituals, asking over and over for reassurance, behaviors based on superstitious beliefs such as fixed bedtime rituals to ward off evil, or the need to avoid stepping on cracks on the sidewalk, a feeling of dread if some arbitrary act is not performed, the overpowering need to tell someone something or to ask someone something or to confess something, the need to touch, tap, or rub certain objects repeatedly, counting compulsions, counting panes in windows or billboards along a highway, for example, mental rituals such as reciting silent prayers in an effort to make a bad thought go away, and excessive list making. So these are just some of the few compulsions and obsessions that OCD can look like and present itself in people. So now we're gonna look into the 4 steps. In recent years, there have been major advances in treating this condition. More than 2 decades of research by behavioral therapists have documented the effectiveness of a technique called exposure and response prevention. The use of this technique involves systematic exposure to stimuli that brings on OCD symptoms, such as having a person with OCD touch a toilet seat or other objects that he or she fears are contaminated and cause the person to have obsessions and compulsions. The therapist then enforces extended periods during which the person agrees not to respond with compulsive behaviors. These periods in turn cause tremendous amount of anxiety that lasts an hour or more and call for a significant amount of assistance by a trained therapist. As the therapy progresses, the intensity of the anxiety decreases and the person gains much better control over the OCD symptoms. At UCLA School of Medicine, where we have been studying OCD for more than a decade, we have developed a simple self-directed cognitive behavioral therapy to supplement and enhance this process. We call it the 4-step self-treatment method. It is a technique that does not require expensive professional therapy or the use of medications. By teaching people how to recognize the link between OCD symptoms and a biochemical imbalance in the brain, we are able to develop this method that very effectively treats persons with OCD solely with behavior therapy. In this book, I will teach you how you can effectively become your own behavior therapist by practicing the 4 steps. This method can be used with or without a professional therapist. You will learn to fight those urges and redirect your mind to other, more constructive behaviors. For the first time ever, for any psychiatric condition or any psychotherapy technique, we have scientific evidence that cognitive behavioral therapy alone actually causes chemical changes in the brain of people with OCD. We have demonstrated that by changing your behavior, you can free yourself from brain lock, change your brain chemistry, and get relief from OCD's terrible symptoms. The end result is increased self-control and enhanced self-command, resulting in heightened self-esteem. So they have mentioned that this is a very good way to help control your compulsions, and it does show that you can use this method without having to be using a high therapy program or medications. However, there are really good therapy programs and medications that I get to use, and I know a lot of other people get to use, that really help with the symptoms and the anxiety and cutting down the need to do repetitions. So there is a lot of medication out there available and a lot of therapy programs that help do ERP, exposure response prevention, so that along with therapy and medication, you can combat OCD. Knowledge, as they say, is power. There is a huge difference in the impact an obsessive thought or urge has on a trained mind compared to what it has on an untrained mind. Using the knowledge that you will gain by learning the 4 steps, you will not only have a powerful weapon in your battle against your unwanted thoughts and urges, but you will empower yourself in a much broader sense. You will take a big step towards strengthening your ability to attain your goals and improve the quality of your day-to-day life. You will develop a stronger, more stable, more insightful, calmer, and more powerful mind. If people with OCD can do so, it is highly probable that those with a wide variety of other problems of different degrees of severity can too. Other disorders include uncontrolled eating or drinking, nail biting, hair pulling, compulsive shopping and gambling, substance abuse, impulsive sexual behaviors, excessive ruminating about relationships, self-image, and self-esteem. The 4 steps can be used to help you control almost any intrusive thought or behavior that you decide you want to change. The 4-step self-treatment method is a way of organizing your mental and behavioral responses to your internal thought processes, rather than just acting impulsively or reflectively like a puppet. And when unwanted thoughts or urges intrude, you can train yourself to respond in a goal-oriented manner and can refuse to be sidetracked by self-destructive thoughts and urges. We call these steps the 4 R's. So as you can see in this introduction, they have this 4-step method, also looking like CBT and also looking like ERP. And using therapy, they say you can combat OCD compulsions and Over time, in the beginning, of course, it's very difficult, but over time, you will see a reduction in the anxiety, or a reduction in the thought, or a reduction in a need to do something multiple times. They can cut down the amount of time you have these OCD behaviors. So, and they also have really good like facilities to go to. Me, for example, I've been to so far 12 facilities, and they are in variation of residential, inpatient, uh, PHP, which is partial hospitalization, and IOP programs. And those facilities are very helpful in helping you get stabilized on meds and then get a perfect therapy treatment to follow. And both of them together is very powerful to help combat OCD. Um, there so far, I would have had tried around 22 to 25 medications until I got the right combination of meds. And there can be more than one diagnosis. You can have OCD, ADD, ADHD, depression, anxiety, PTSD. And yeah, there is treatment resistant depression that can follow the OCD. There is anxiety that follows the OCD. And there can be attention issues or trauma, and especially PTSD, that can come with the OCD. So there are multiple diagnoses that can, worsen or aid helping OCD behaviors or worsen OCD thoughts. So that's why going to a program that can tell you all your diagnoses and help you go to multiple, if so, multiple facilities to help control all the diagnoses and help you get stabilized on medications and therapy, so you have the perfect treatment plan and therapy plan, psychiatrically and psychologically, a perfect plan to help combat the OCD. So now we look at the 4 steps that help combat this. So step 1 is relabel, step 2 is reattribute, step 3 is refocus, and step 4 is revalue. In step 1, relabel, you can call the intrusive thought or urge to do a troublesome compulsive behavior exactly what it is, an obsessive thought or a compulsive urge. In this step, you are learning to clearly recognize the reality of the situation and not be tricked by the unpleasant feelings OCD symptoms cause. You develop the ability to clearly see the difference between what's OCD and what's reality. Instead of saying, I feel like I need to wash my hands again, even though I know it doesn't make sense, you start saying, I am having a compulsive urge. That compulsion is bothering me. That obsessive thought is hounding me. The question then arises, why does this keep bothering me? In step 2, reattribute, you answer that question. You say, it keeps bothering me because I have a medical condition called OCD, and I am having the symptoms of a medical problem. My obsessions and compulsions are related to a biochemical imbalance in my brain. Once you realize this fact, you begin to ask yourself, what can I do about it? And in step 3, which is refocus, you turn your attention to more constructive behaviors by refusing to take the obsessions and compulsions at face value, and by keeping in mind that they are not what they say they are false messages. You can learn to ignore or to work around them by refocusing your attention on another behavior and doing something more useful and positive. This is what I call shifting gears. By performing an alternative, wholesome behavior, you can actually repair the gearbox in your brain. Once you learn how to refocus in a consistent way, you'll quickly come to the next step, which is in step 4, revalue. You revalue those thoughts and urges when they arise, and you will learn to devalue unwanted obsessive thoughts and compulsive urges as soon as they intrude. You will come to see intrusive OCD symptoms as a useless garbage they really are. The 4 steps work together. First, you relabel, you train yourself to identify what's real and what isn't, and refuse to be misled by intrusive, destructive thoughts and urges. Second, you reattribute, you understand that those thoughts and urges are merely mental noise, false signals being sent from your brain. Third, you refocus, you learn to respond to those false signals in a new and much more constructive way, working around the false signals by refocusing your attention on more constructive behavior to the best of your ability at that moment. Hopefully, if you have able to control such anxiety that is at the best of your ability, deserves a reward, because it's very hard, and doing it to the best of your ability at that moment is very much needed and successful if you can in the moment. This is where the hardest work is done and where the change in brain chemistry takes place. By expending the effort it takes to refocus, you will actually be changing how your brain works in an extremely healthy and wholesome way. Finally, the real beauty of step 4 of the 4-step method is seen in the revalue step, when the whole process becomes smooth and efficient and the desire to act on unwanted thoughts and urges has been overcome to a significant degree. You will have learned to view those troublesome thoughts and urges as having little to no value, and therefore your obsession and compulsions will have much less impact on you. Things come together very quickly, resulting in an automatic response that's just a senseless obsession. It's a false message. I am going to focus my attention on something else. At this point, the automatic transmission in your brain begins to start working properly. This can take time, but when it does happen and you start seeing the improvement and things start working properly again, it is very exciting because it's hard and long, but worth it at the end. Very much worth it. And when you see that, it's pretty rewarding. Once people learn to perform the 4 steps on a regular basis, 2 very positive things happen. First, they gain better control over their behavioral responses to their thoughts and feelings, which in turn makes day-to-day living much happier and healthier. Second, by alternating their behavioral responses, they change the faulty brain chemistry that was causing the intense discomfort of their OCD symptoms. Since it has been scientifically demonstrated that the brain chemistry in the serious psychiatric conditions is changed through the practice of the 4 steps, it is likely that one could also change one's brain chemistry by altering responses to any number of other behaviors or bad habits through using the 4 steps. The result could be a lessening of the intensity and intrusiveness of these unwanted habits and behaviors and making them easier to break. This is majority of the introduction. I will post a part 2 video of the rest of the introduction.